Good afternoon, everyone. This is Val Arkush, Chair of the Montgomery County Board of Commissioners. Today is Wednesday, October the 21st. We are in week 33 here in Montgomery County of the COVID pandemic and week 17 in the green phase. Today, I'm joined by my colleague, Commissioner Ken Lawrence. Since our October 20th press release, we have 41 new cases of COVID-19 reported in Montgomery County, which brings us to a total of 12,975. These positive cases are a result of a positive test for the virus, not from the antibody test. All 41 of these cases are from the community. 38 tests are from the last 7 days or less, and 3 tests are from 8 to 14 days ago. These positive individuals are from 23 municipalities. All 62 Montgomery County municipalities are home to individuals with COVID-19. Today's individuals range in age from 11 years old to 77 years old. And as always, you can check our county map found at moncopa.org/COVID-19 for updated geographic information. Today we have 20 females and 21 males. I am pleased to confirm that no additional Montgomery County resident has lost their life to COVID-19, which leaves us at 837 deaths confirmed positive from COVID-19. In terms of hospital beds, today the number of hospitalized COVID-19 patients in a Montgomery County hospital is approximately 39, with 7 individuals requiring a ventilator, or approximately 18%. There is nothing new to report from the Montgomery County Correctional Facility. They are currently stable with no new cases. Testing continues to go smoothly in our 10th week with Mako Medical. With rare exceptions, excuse me, the county's results are available within the contractually promised 36 hours. I do want to remind people being tested that at the testing site, you'll be given information on how to register to get a text or an email from Mako as soon as your test result is ready. I encourage you to sign up for that notification. That is the fastest way to get your result as soon as it is available. Our testing capacity is currently at 50 tests per site per day. This provides 300 tests per day across the county sites. We do continue to have good availability of testing. We are actively planning to increase the testing capacity at our 4 busiest locations to 75 tests per day in early November. I should be able to announce those details next Wednesday. I want to urge anyone who wants or needs to be tested to get tested. The more we're able to test our community, whether you have symptoms or not, the more we will know about what is happening across the county and be able to quickly suppress any outbreaks. For the 14-day period ending October 16th, 30,447 Montgomery County residents were tested for COVID-19, which is an increase of 2,103 people tested compared with the 14-day period ending October the 9th. This is great. This is so helpful to our tracking and to our understanding of exactly what's going on in our community. As a reminder, the 6 county COVID-19 testing sites do not require a car to be tested. These sites provide testing at no cost, though insurance will be billed if you have it. They do not require a healthcare provider's order, and we will test individuals of any age who want or need to be tested. These sites do require an appointment. All appointments are made on the day of testing, beginning at 8:30 that morning. You cannot book ahead. We do require that the person being tested is a resident of Montgomery County or works or goes to school in Montgomery County. And I do want to emphasize that you will not be billed or charged a copay for a COVID-19 test at a Montgomery County run testing site. That may not be true for any other location that you get tested. So if that is a concern, you should be sure to ask before you undergo that testing. As a reminder, our testing sites are in Pottstown, Lansdale, Willow Grove, Green Lane, Ardmore, and Norristown. To register for a test, go to montcopa.org/COVID-19, click on the green County Testing Information button. And as a reminder, appointments open at 8:30 on the day of testing. They do not open at 8:29. So make sure you're on at 8:30, but if you get on before, it'll say it's closed. You can also make an appointment by phone. That phone number is 610-970-2937. And we have language line support available at that phone number. So any individual can make an appointment in the language, using the language with which they're most comfortable. Working together, we continue to suppress viral spread here in Montgomery County. But like many other parts of the Commonwealth and the country, Montgomery County is seeing an increase in confirmed positive COVID-19 cases. This increase is partially due to more individuals being tested, which we strongly encourage, but it also serves as a reminder that as the weather's getting cooler, we're seeing increased transmission in our. We expected this, but we must all continue to take common sense steps to reduce the spread of this very, very contagious virus. So let's take a look at how we're doing today. We'll start with our date of test graph. So as a reminder, this graph shows all the people that tested positive based on the date that they were tested, and that's the gray bars in the back. And then we have a graphical representation of running averages of these positive individuals. So the red and pink are the total 7-day and 14-day averages. The dark blue and lighter blue are the community 7-day averages. And then way down at the bottom in the orange and the yellow are the long-term care facility 7-day and 14-day averages. So why don't we go ahead and zoom in on that. And you can see that we're experiencing kind of a slow, happily slow, but steadily rising increase in our average positive data. So thankfully, our long-term care facility numbers remain nearly zero, but in our community, we're seeing a steady rise of cases. Just want to continue to urge people to be careful and know that there's plenty of virus out there, and you just need to continue to be cautious. When we look at our positivity graph for our latest few weeks here, and this now goes through the Friday, October the 16th, you can see by that very jagged orange line in the background, that's the number of people who were tested, a number of Montgomery County residents who were tested on any given day. So that number is continuing to go up, which is great. And our positivity is staying pretty flat as a result of that. So that's important. That means that we're doing enough testing in our community to be able to rapidly get a handle on any outbreaks that might be beginning, get in there with our contact tracing team, and hopefully make sure that those individuals are isolated and all their contacts are quarantined. So this is great. And we want to make sure that we continue to keep that up. Our positivity as of Friday is 2.31%. And that is compared to 2.28% the week that ended October the 9th, when we reported this last Wednesday. Now, we've got a couple new graphics for you this week. Actually, this next one we've seen before, but it's been quite a while since we've seen it. And I just wanted to remind everyone how serious the consequences of COVID-19 can be. We have had 837 deaths in our county since this pandemic started. And in the United States, across our country, we're now up to 221,550 deaths. And one way that we try to put this into context for people is to look at historically how many deaths would we expect in any given month, in any given year. And then what are we seeing this year compared to that? So this is what you have in front of you. The gray lines in the backwards that are all kind of jumbled together are our monthly deaths in 2015, 16, 17, 18, and 19. And you can see that those gray lines are, nearly identical. We have a little bit of variation from year to year, but not very much. The green line that you see represents our deaths, our total number of deaths during 2020. And you can see that peaked up at 771 back in April. The yellow line is our COVID-19 confirmed and probable deaths. So the green line is the total number of individuals that passed away during those various months. And then the yellow line are the ones that are confirmed COVID positive or considered a probable death from COVID-19. So that's the yellow line. And then the red line is what we would call the excess number of individuals who have passed away during this time period. So some of this is from COVID. Some of this may be from other factors. Individuals who were experiencing symptoms of a heart attack but were too concerned to go to a hospital to seek care. Some of this includes overdose deaths or other deaths of that type. But we just want to, as a reminder, as a very sobering reminder, just remind people how serious this has been and could continue to be as we head into this fall period and we do start to see our case numbers tick up. We never want to be back where we were in the spring. And I just wanted to put this up as a reminder of where we've been and where we certainly do not want to go back to. So, as another way of giving some information about this, this is a new graphic that we've made for you today. And this is a snapshot comparing where we are as of October 16th, and that's the far right column. And we're comparing it to what was really one of our worst days during this pandemic, which was Friday, April the 24th. And we're calling that our worst day because that was the highest 7-day average of cases that we had at the time. And then we're also comparing it to one of our best days, which was June the 17th, when we had the lowest 7-day average of cases. So just to go through this a little bit with you, the first line is our 7-day average of cases. It was 162.9 back in April. It was down to 26.7 in June, and now we're at 44.6. Positive tests on April the 24th, 275, just on that day. On June the 17th, we were at 35. Today, we're at 42. Yesterday, we were at 67. So again, we are moving in a direction that I'm not too happy about. Our case trends back in April, we were way up. The 7 days that ended April 24th compared to the previous 7 days, we had a 39.7% increase in cases. In June, we had a 35.5% decrease. As of last Friday, we had a 2.9% increase. And our 7-day incidence rate, 137 cases per 100,000 population back in April, 22.5 in June, and now we're at 37.6. Now, the good news is all the numbers that come after that. Our infrastructure is so much better than we were back in the spring. Our long-term care facilities are in a dramatically different place than they were back in the spring. Our hospitalizations are lower. The number of individuals who've passed away from COVID-19 is lower. Our testing dramatically increased, and our positivity rate reflects that. And our ability to do contact tracing dramatically increased. These numbers represent the number of cases to be traced assigned on those days. So we've made a lot of progress. It's also interesting to see that our average age has come down a little, but not as much as I think people might think. We were at 56 years and 8 months back in April, 54 and 4 months in June, and 47 years and 11 months now. So again, this, for us here in Montgomery County, never has been, and it doesn't continue to be, a purely a disease that is affecting older individuals. So just want to share that data with you so that you have a very clear understanding of where we are as a county and how we're doing, and where we've been, where we certainly don't want to go back to, but where we're starting to see some trends up. And hopefully everyone can continue to do what they're doing, not leave home without a mask, put it on whenever you're within 6 feet of someone who's not in your household. Keep that 6 feet distance as best you can. Keep your hands clean, get tested, and cooperate with contact tracing. As always, I just have to continue to stress the importance of cooperating with contact tracing. These conversations give us so much information, and it's a two-way street, and I want to share some of those stories with you today. 97% of the people that we reach are extremely cooperative with our contact tracers, but we do continue to struggle to reach 30 to 35% of the people that we absolutely need to be talking with. So we hope that you will call us back if we leave you a message. I asked our contact tracers for some stories, and they shared a couple of things with me. First of all, they said that when they do speak with people, that people are very anxious and they're very confused, and they always have a lot of questions. They're confused because there is so much bad information on social media and on the internet, and a lot of it is very conflicting. So our contact tracers say that once they're done talking with people, they are so greatly relieved. They're very clear about what they should and should not do, and they have factual information upon which to act. They also told me a story about a husband and a wife from a couple months ago. Both came down with COVID. They'd lost their jobs because of COVID. The husband ended up being hospitalized due to COVID, and they just did not have enough money for food. So through the interventions of our contact tracers, they were able to be connected to some support services to make sure that they had enough food to keep their family safe. Another story I heard is that one of our contact tracers worked with an individual who was a teenager. This teen's family and extended family were all diagnosed with COVID. The teen was very anxious about their COVID diagnosis and was afraid that they were going to die. The teen was upset that they were going to miss an upcoming sports tournament. The tracer talked to the mom and the teen regarding their fears, and they decided to call this time that the teen had to spend in isolation a relaxation period, which the teen was a lot more comfortable with. The contact tracer gathered information regarding other activities that the teen could do from home, including how to make a do-it-yourself mask, lists of good Halloween movies, and several other activities that the contact tracer emailed to the mom. The contact tracer reinforced that since the teen was healthy, with no pre-existing conditions, and an athlete, they were most likely to recover and be okay. The mom emailed the contact tracer last week with a big thank you. The teen is recovering nicely, and all the things that we sent helped keep the teen busy and less stressed during their isolation. So when we get good contact tracing, we learn from that information, and we can let you know what type of activities are putting individuals at risk. And we can also learn about what activities do not appear to put individuals at risk. For example, I am frequently asked by seniors about going to the grocery store. And many seniors are still very, very concerned about this very important activity to go buy food. And so far, grocery stores are not a place where we have evidence of transmission of COVID-19. But social gatherings continue to pose a risk, particularly if they're indoors and food is involved. The issue with food is not the food itself, but it's that people have to take their masks off in order to eat the food or drink the drinks. So grocery stores, so far so good. Social gatherings continue to pose a risk in many, many situations. So don't relax, keep that mask. We need to keep that mask on as much as possible. And I want to remind everyone again about the COVID Alert PA app. This is a free mobile app that you can download onto your phone. It helps notify and give public health guidance to anyone who may have been in close contact with another person who has the app and later tests positive for COVID-19. The app uses Bluetooth only. It does not use any kind of GPS location, and it works without revealing the user's identity or location. So if you do get notified that you've been exposed to COVID-19, it does not tell you who you were exposed to or where you were exposed, but it does let you know that you've been within 6 feet for longer than 15 minutes of someone that is now tested positive for COVID-19. Another nice feature of the app is that it's now used by the states of New Jersey, New York, and Delaware. So if you do happen to travel to those states for work or for some other reason, you would be notified about exposure in those states as well. I think this is a great tool for our business owners, particularly those businesses that are public facing. If your employees all have this app, it just helps keep everybody safe. It would let your employees know if they had been exposed. It can help keep your business safe. So please, I really urge everyone to download this app. The more people that have it, the better. I've had it on my phone since it came out. You can get more information about this at montgomery.org/COVID-19. And we have a link on that website to more information about the app. I want to remind everyone again this week about our Montgomery County Office of Public Health walk-up and drive-through flu clinics. Our 6 walk-up flu clinics are open on Thursdays in Pottstown, Green Lane, Willow Grove, Lansdale, Norristown, and Ardmore. And our drive-through clinics will take place on Fridays and Saturdays. We have 2 of those left. This weekend, the 23rd and 24th, it's at the Montgomery County Community College campus in Bluebell. And then on October 30th and 31st, it's at the Greater Philadelphia Expo Center in Oaks. The flu shots are offered at no cost to individuals age 6 months and older who live, work, or go to school in Montgomery County. We do ask that you make an appointment for any of these locations. To make an appointment, you can visit montgomery.org/flu or call 610-278-5145. That's 610-278-5145. I also want to remind you that the Montco Cares grants are open for applications. A couple of weeks ago, we announced this new program to help Montgomery County families with their child care needs, as well as Montgomery County child care facilities. The commissioners have allocated up to $12 million of the Federal CARES Act money to help both our families and our daycare facilities. The program is administered by our Early Learning Resource Center in conjunction with the Montgomery County Department of Health and Human Services. There are grants available to families. They will provide financial support to help pay for child care for children, including school-aged children up to age 13 who are enrolled in a Pennsylvania Department of Human Services licensed child care facility. And I do just want to point out that a number of our child care facilities are making accommodations for school-aged children. So for parents who are working, whether it's in your home or outside of your home, if it feels safer and better for your child to be in a supervised setting during the day, during the school day, you are eligible for funds to help cover the costs of that. The support will cover the cost of childcare from October the 5th through December the 30th. The support would be paid directly to that childcare provider, and applications are open right now. You can learn more about it by going to the website that you can see on the graphic, montcopa.org/Montco Cares Program. Similarly, there are grants available for child care providers. As long as you are a licensed, state of Pennsylvania licensed child care provider, you can go to that same site and get all the information that you need to put in an application. So far, we've received applications from 114 providers and over 100 families, and we still have plenty of money to allocate. So please consider applying for these grants. Also want to remind people about the Your Way Home emergency rent and utility grants that are available. As you probably have heard, Governor Wolf's moratorium on evictions and foreclosures expired at the end of August. About a week or so ago, the Pennsylvania Utilities Commission also voted that they would start disconnections for people who are behind on their utilities in November. So we just want to remind people that we have both rent and utility assistance available to you. Households who've experienced a COVID hardship are eligible to receive up to $1,500 per month in assistance for overdue rent or utility payments dating back to March 1st of 2020, with a maximum of 6 months worth of rent or utility payments, or up to $9,000. And these are grants. This is not money that has to be paid back. Households in need can access this program by calling Your Way Home by dialing 211, that's 211, or you can text your zip code to 898-211, or you can contact any of our partner agencies that are helping us with this program. Those agencies include ACLAMO, the Community Action Development Commission, also known as CADCOM in Norristown, MANA on Main Street, and the Pottstown Cluster of Religious Communities. And all of their contact information can be found by visiting montcopa.org. In the search box, type COVID-19 Rent Relief Program. All right, and with that, I will turn over to Commissioner Ken Lawrence.
All right, thank you, Val. We are just under 2 weeks away from Election Day now, but election 2020 is well underway in Montgomery County. So first of all, if you're planning to vote in person on November 3rd, all of our polling locations have been finalized. We have 298 polling locations in Montgomery County, and every voter should have received a letter now with their correct polling place. This announcement is for mail-in ballot voters who applied before October 10th and have not received their ballot yet. We've created a form on the Voter Services website called the Ballot Status Request Form. We would ask you to go to the website, fill out that form with all the information there, and I think they're going to show that now. And someone will call you back within 24 to 48 hours with a status update on your ballot or to go through your options with you. We know that there's a lot of interest in the mail-in ballot portion of the election, so we've created a new chart on the homepage of Voter Services website to show the progress of the ballots. It includes, as you can see, the number of applications we received, the number of ballots that have been mailed to voters, the number of ballots requested in person at Voter Services offices, and the number that we have received back from Montgomery County voters. And I can tell you, this update was from yesterday. As of right now, we have received 115,644 ballots have been returned to Voter Services so far through our drop boxes and UPS. So we have over 100,000 ballots back at this point. All the drop-off boxes are available Monday, Wednesday, and Friday from 9 a.m. to 4 p.m., on Tuesday and Thursday from 11 a.m. to 6 p.m., and on Saturday and Sunday from 11 a.m. to 4 p.m., except for on Election Day, November 3rd, and the Election Day hours will be from 9 a.m. to 8 p.m. And all the locations are listed on the Voter Services website. Ballots placed in the secure ballot boxes will be delivered daily to Voter Services and stamped as received. We also have our 4 satellite Voter Services offices, which will remain open until October 27th. And at these offices, you can do a cancel and replace for a mail-in ballot, and wait for that ballot to be printed out and vote it right there and leave it right there, and not take the postal office out of the equation at all. So everything you need to know about the election and voting in Montgomery County can be found on the Voter Services website at www.montcopa.org/election2020. Monday was the last day to register to vote. So if you have not registered to vote, you cannot vote in this election. But the last day to apply for a mail-in or absentee ballot is October 27th, 2020 by 5 p.m. Postmarks do not apply your application must be received at voter services or one of our satellite offices at that time. And I would encourage you to use the satellite offices if you can, but please don't wait until October 27th unless there's absolutely no other option to do that. I just want to remind people as they fill out their ballots to please use black ink, which is recommended by our voting system vendor. If your ballot arrived with a marked out black box covering one of the addresses on the envelope, it's okay. Your ballot is okay. Your ballot was printed with your address showing twice on the outside envelope. The Postal Service asked our printer to cover up the second address as to not confuse postal carriers. So it was covered, but there's no worries. Your ballot is fine. Please don't forget to check your completed ballot to make sure you voted in every race and put it in the privacy envelope before putting it in the outer envelope, and make sure that you sign that and date it. And it's not your date of birth. It's the date that you're signing the declaration. Next, Saturday is Drug Take Back Day, and this is organized by the Montgomery County District Attorney's Office and the Police Chiefs Association of Montgomery County. The event will run from 10 a.m. to 2 p.m. this Saturday, October 24th. All of the locations are staffed by police officers. Take Back Day in Montgomery County is a chance for residents to clean out their medicine cabinets of unwanted, unused, and expired prescription and over-the-counter medications and dispose of them easily in a safe, environmentally friendly way. Ridding medicine cabinets of these medications in an environmentally safe way is an important step for the safety of all households. Through the pandemic, overdoses and overdose deaths have continued. Clearing out medicine cabinets and bathroom cupboards of unwanted and expired medicines is an essential way to keeping your home safe. The following medications are accepted during Drug Take Back Day and throughout the year at permanent med return boxes at police stations: prescription and over-the-counter tablets and capsules, inhalers, creams, ointments, nasal sprays, pet medicines, and vaping projects. Needles and intravenous injectable solutions are not accepted. And please remember, if you're dropping off medications, please wear a mask as you drive through. The participating sites for this upcoming Take Back Day are all listed on the District Attorney's website at www.montcopa.org/DA. But back to you, Val.
Great. Thanks, Ken. So our next briefing will be next Wednesday, the 28th at 3 p.m. And with that, I'll be happy to take questions.
This afternoon, we're joined by Jim Melwert from KYW and Deanna Durante from NBC 10. We will start our questions with Jim.
Hey guys, I'm kind of all over the place here. I guess I'll start with Department of State, Secretary of State, Kathy Bookfart today had a press conference and addressed the confusion over the confirmation emails from people who have returned ballots and I guess a delay in those ballots. And my understanding was one of the issues was that the counties, as they process ballots, are limited in the file size that they can process. So you have to stop after, or I don't know if stop's the right word, but you can only upload so many ballots at a time. And my understanding was it was a few hundred. She says it's 1,000. And that they're working on that. Is there any clarification on that? I don't know who wants to take that.
I'm going to let our chief clerk, Lee Saltesiak, take that question.
Due to limitations of the state's IT infrastructure, the process to confirm receipt of ballots after we receive them can take up to a few days. The processing time has improved since we first started this process, but as of this morning, we are only able to process up to 200 ballots at a time to confirm the receipt. In fact, we got a call this morning from the Department of State confirming that we should not go above 200. So whatever the number is, 200 or 1,000, the point is it is a very manual process, but voters, I think the important thing is that voters can be reassured that we are receiving thousands and thousands of ballots every day. In fact, today, 20,000 ballots arrived. So the system is working. We are receiving your ballots once they are either mailed or put into our drop boxes. Once the ballots are received by the county, we date stamp and sort every single one, and they are put into a locked room under 24-hour surveillance where they'll be until Election Day. So the processing times to confirm receipt of the email, the ballot, once we receive them, does take a few days, but rest assured people will get their confirmation. They'll be able to check their status on the Department of State's website to confirm that the county has received their ballot. And we will keep working to process those ballots as quickly as we can.
This is a hypothetical question, I guess, but 50,000 ballot applications approved and already 95,000 some ballots returned. Is there a hope or optimism that you don't get that last minute crush, or is it too early to say that?
I think it's
Last minute crush. What do you mean by last minute crush?
Similar to what you saw in the primaries, where you had a significant number of ballot requests on the deadline day, and then a scramble to try to get those out and back.
As I said during the primary, and I actually believe that the deadline should be 2 weeks, but that's not within my power. If you wait until October 27th, you're pushing it to the limit there for us to turn that around, get that back out. You would certainly, definitely, I would think, want to use a Dropbox at that time. But emergencies happen. But if people are planning to vote by mail, I think they need to apply now and not wait until October 27th.
Finish up with COVID. Val, we're hearing out of Harrisburg that they believe this is the start of the quote unquote fall resurgence. Do you agree with that? And can you explain what that might look like in Montgomery County?
I do agree. As I said earlier in this briefing, we've been seeing a thankfully slow but steady increase in our numbers here in Montgomery County. And my hope is that people will continue with all of these measures that have enabled us to keep our numbers relatively low these last several months. And if people really do stay compliant with that, and they're very careful about social gatherings, particularly ones that are indoors, and they really try to avoid that as much as possible, hopefully, while I fully expect to see an increase in our numbers, hopefully it is one that is manageable. The good news is that our hospitals are better prepared. They have, our medical colleagues have a much greater understanding of how to treat this disease. And so you're seeing fewer patients who need ventilators and some of the more really high intensity care. So that will hopefully help protect our hospitals. We also know now something we didn't know in the spring, which is the critical importance of wearing a mask or a face covering when you are out of your house and around any contacts that are not from your household. Every week we get more data showing the effectiveness of mask wearing. So we know a lot more than we knew in the spring. We are definitely better prepared. We have a whole county infrastructure in terms of testing and contact tracing that is significantly better than it was back in the spring. So my hope is that we'll be able to get through this okay, without having to take any dramatic steps backward. But whether or not we're able to do that will depend on everyone in our community just taking a deep breath and not getting just fatigued from all of this, which of course everyone is, but resisting the urge to relax and get rid of their mask and go to a party. It is truly in the hands of the people in this community. If people continue to do what they've been doing, I'm hopeful that we'll get through this okay. But if they don't, if they throw caution to the wind, we could really start to see quite a rise here.
Is there something, and then just a quick follow up before I hang up here, are there any metrics or any numbers or anything that you're kind of watching that could possibly lead to that step back?
Well, we're watching our incidence rates, our positivity rates, our absolute numbers each day, as well as our hospital numbers. And so far, we're okay. But we will be keeping a close eye on those things. And of course, it's possible, particularly if our hospitals start to be inundated again with patients. That would be the type of thing that would make us have to seriously consider other steps.
Thanks.
Thanks, Jim. Now we'll move on to Deanna Durante.
Hi. We saw on the chart earlier that you displayed about, showing the peaks in the virus, and we saw the Labor Day peak. Halloween, Thanksgiving, Christmas, many fall holidays are coming up, and those are not events that you celebrate outside on a beach or in a backyard. So what do you predict that it's going to look like during the holidays, since we're in the middle of this fall resurgence?
Yeah. Well, I would just remind you that we had a little bump around Labor Day, but it wasn't that bad. It wasn't nearly as bad as what we saw after July the 4th. And I think that's because people understood that their behavior really does matter when we look at these outbreaks. So we've issued guidance around Halloween that can be found at moncopa.org/Halloween guidance to make Halloween still really fun. And, we put out ideas about trick-or-treating and lots of other activities, but to also make it safer, to really reduce the risk of transmitting COVID. My team is working on guidelines around Thanksgiving, which is going to be the next big holiday where families, often come together and travel in very large intergenerational groups. So, we'll have to really urge some caution around that. And again, people just have to be safe. They know what to do. I'm sure that everyone listening to me can recite the drill in their sleep about wearing a mask and staying 6 feet apart and keeping their hands clean and getting tested and cooperating with contact tracing. And if people do that, we will get through this okay. But they have to do that in every day. There can't be a day off.
In the news conference on Monday from Harrisburg, where Governor Wolf and Dr. Levine talked about this fall resurgence, they also listed a number of percentages on people who had tested positive and where they had been. And they talked about those that went to restaurants and bars and hair salons and gyms. And I'm curious what we're seeing here locally with where we are seeing transmission. Are we seeing issues in restaurants? Because restaurant owners say that we are not. Are we seeing bars? Are we seeing social gatherings? What's our main point of transmission? And do we have any, undetected community spread? What's our percentage of people that we have no idea where they've gotten it?
So in terms of location, social gatherings continues to be our number one area of exposure. And it's been that way, for weeks. So social gatherings is really the time that we see trouble, particularly, as I said earlier, if it involves food and people are taking their masks off in order to eat. I think the other thing that can cause an issue is events where there's loud music. And so people end up just standing closer together so they can hear one another. And particularly if they have their masks off, that just increases the likelihood of transmission. So we have yet to see any documented transmission in the school setting. We've had plenty of schools with positive cases. We've had many, many sports teams with positive cases and had to quarantine entire teams. But thankfully, we've not seen any transmission. We have not documented any transmission in Montgomery County restaurants at this point. But, I do just want to remind people that those restaurants until very, very recently were at a very limited indoor capacity. Most of the eating was going on outdoors or through takeout. So I think it remains to be seen what happens as people move indoors into restaurants that are now being allowed, if they've self-certified, up to 50% capacity. So I think the jury is still a little bit out on that one. Certainly in other localities, and there's some recent CDC data that came out, fairly high percentages of people who tested positive had been in a restaurant in the previous 14 days. So, I think we'll have to see what happens there.
Thank you.
Thanks, Deanna. Next, we'll go to Teresa Harris with some questions from reporters who couldn't be with us here today.
Yes, I have two questions from Kevin Tierney at More Than the Curve. He's asking, has the county spoken to National Board of Osteopathic Medical Examiners about their conference or test taking in Conshohocken, their continued efforts to hold their exams, since their exams bring thousands of people from around the country into the county?
Yeah, we are aware of this scheduled exam that's coming up in a couple of weeks, and my Office of Public Health is reaching out to the folks at the National Board of Osteopathic Medical Examiners. I have not gotten a report back yet on how that conversation is going.
Mm-hmm. The second question is, has there been any student to teacher or staff infections in public or private schools?
So far, we have not documented any transmission of COVID in any of our schools. Many cases, many people who've tested positive, but the mitigation measures do seem to be working. And at least so far, we've not been able to document any actual transmission.
Thank you. There's no more questions.
Okay. All right. Well, then, thank you very much, everybody. Have a safe week, and we will see you next Wednesday. Thanks.